Okay, so anybody who's from the north of Ireland will know I have a real challenge on my hands in terms of outlining our policy and our strategy. It's very outdated, and I'm going to go through the process, but I'm also going to highlight and sell the research that's taking place across the island of Ireland, and in particularly the north of Ireland. So I've been asked to present a perspective from the north. Should have had my glasses on. And I suppose what I wanted to do was, first of all, focus on what unites us as an island. And we have many things that unite us. And I suppose the biggest one is that palliative care services across the island of Ireland are stretched. They are really, really stretched. Also, we have ageing populations with much more complex needs. In fact, much more so than the UK and the mainland. So we very much have that in common. We also have major workforce challenges, and I can see Karen was alluding to the workforce there in the policy that the Republic has, and that's something we're actually quite jealous of, that very structured policy that you have in place. But we have major workforce challenges, particularly in our rural populations. Again, another thing that really unites us. The other thing is we have a changing policy landscape. So although you've talked about the policy that you have in the Republic, it's in its infancy. So we're starting to see that fruition. We're starting to see implementation plans. We're a wee bit further behind in the north, and I'm just going to highlight where we're at in relation to that. I would say we're in a state of flux. So the current regional strategy that we have is Living Matters, Dying Matters. It's a 15-year-old strategy. It's supposed to be a 5-year. It has very, very important elements in it that still stand to this day. The reason we need it updated is that many of them were not implemented in their fullest. And the other thing is we've very changing demographics. So it no longer meets the needs of the population in the north of Ireland. We had a clear identification from Marie Curie leading this that we needed a new regional strategy in the north of Ireland. And what we had was, I think, quite an intuitive process that took place in the north, and we had a health inquiry. And the health inquiry brought clinicians, researchers, academics. I see lots of people in this room who presented to it. And we also had people by experience, and also the All-Ireland, just showing where the All-Ireland sits in this in terms of an All-Ireland perspective. So that health inquiry went on for a number of months, where we presented to the Health Committee in relation to what we feel is important for palliative care in the future across the north of Ireland. We were supposed to have our priorities set in October, November time. They are now going to be published on the 9th of December, and we're really looking forward to see what's coming out of that. We have seen a flavour of what's coming out in terms of priorities. One of the biggest ones is funding. Funding in the north of Ireland for palliative care is very different to the Republic, whereby the majority of it is charity funded. And we're actually having coffee mornings, all the rest of it, to try and fund caring for the most vulnerable part of our population, those people who are at the end of life. The other thing is education, again, synergy with what's happening in the Republic. There's a big push for education of our specialists, palliative care workforce, but also our generalists. Specialists can't do it all, and there's that recognition of care in the community and the need to educate our generalist workforce. And also the implementation of our advanced care planning strategy. It was launched in 2022. You'll see a bit of a pattern here in the north. Very often we launch things and they don't end up being implemented for a number of years, but we are promised that there's key plans in place for the implementation of the advanced care planning policy in the coming year. So we haven't got a new strategy yet, but it is on the way, is what I would say. We have several policy drivers that are driving things forward in the north of Ireland. We have the All-Parliamentary Group in Terminal Illness, and that's a really key priority. So that are our Pacific members of the Health Committee, who have a specific interest in palliative, terminal illness and chronic disease. I sit on that as do members of the All-Ireland, as do my colleagues from Queen's. And what that does is it gives us a clear insight into what's happening in policy, but it also gives us a voice as well there. And there's also members of People by Experience, and there's the voluntary organisation. So it's a fantastic thing, I think, that we are doing well in the north. We also have our colleagues, our Palliative Care and Partnership, who are very much our driving forces in this. And they sit under the Department of Health and, of course, the Public Health Agency, who are instrumental in terms of driving this forward and instrumental in funding many of the initiatives that I've been involved in and that the All Ireland's been involved in. So the Public Health Agency has a real role to play. What we see is that policy is very much influenced by research. So we're seeing that the research we've undertaken in the north of Ireland is influencing some of these recommendations, but we're also seeing that research influences the policy as well. We're seeing that two-way drive there. And we're also then, the major thing that we want to see is from policy and from research is an improvement in clinical practice. There's no point in doing any of it if we don't see a change in clinical practice. So that's all I can present on the policy. But what I am going to do is sell a wee bit about the really good research that's undertaken across the north of Ireland with many colleagues in the Republic across Queen's and Ulster University. I'm just going to give a snapshot. Okay, and there's many colleagues in the room that you can go and have a chat to around this. So we're doing some joint research. Queen's and Ulster are working very well together. We're a small island and we do work very well together in this area. So Queen's and Ulster are involved in the evaluation of a single point of access, which is a Belfast Trust initiative with Marie Curie and the Northern Ireland Hospice. And what they aim to do is to triage, it's a phone call triage, that somebody out in the community who needs to be seen will be seen that day. And that is something that is really needed across Northern Ireland. That is in one trust. We will evaluate that. If that's evaluated as successful, we're hoping to implement that across the north of Ireland, across all 5 trusts. We also have an R&D fellowship, and I know Kasia is here today, led by Dr. Felicity Hassan, looking at the key role of the healthcare assistant and the role that they do as a lone worker. So that's our joint research. I'm going to sell a wee bit about Ulster and then a bit about Queen's. We have several workforce streams. So we have one particularly on workforce, we have public health, we have advanced care planning, we have our underserved populations, and we have our family-centred oncology streams. So service delivery is led by Dr. Felicity Hassan. Anybody who knows Felicity knows she's very passionate about workforce, in particular our healthcare assistants, and in particular about lone working and out of hours. And she's done some regional work in the north of Ireland and UK, and also she's involved with Dr. Tracy McConnell in terms of the R&D fellowship as well. We're also involved in Hospice at Home, where we've worked with the AIIHPC Foundation, where we've looked very clearly at looking at international models of care and seeing how we can translate those into the Irish context and seeing what would fit best in terms of out of hours. We've our pre-hospitals, so we've worked with paramedics going on, and we also then have the development of the key worker, which is a major thing within the north of Ireland, where the district nurse in Northern Ireland is identified as the key worker for palliative care. But there's a lack of research into what that role is. There's a lack of clarity in terms of what that role entails and in terms of the support systems that those nurses need to undertake that role. So Professor Sonia McIlpatrick, well known to everybody in this room, I'm sure, leads up the public health approach to palliative care. And she leads that up from an Ulster perspective, but not only that, from a European perspective, looking at the AIIHPC work that she does. We've done some Life and Times surveys, and we've clearly identified that there is a lack of public knowledge in particularly Northern Ireland, which was quite interesting, where we're seeing there is a lack of knowledge on palliative care and in particular advanced care planning. There's also then our My Home Life project, which is a large project that's gone across a number of years, and again direct from policy. The majority of people living in long-term care settings across Ireland are in the last number of years of their life and are actually many of them living with a palliative illness or terminal diagnosis. So there's some really good work going on there. I'm going to fly through this. We also have then Professor Chera Semple and Dr. Jeff Hannah, who are doing some fantastic work, and it sits with one of your priorities. I could see that sitting really well, looking at supporting children, dependent children whose mother or father has been diagnosed with a terminal condition. So a lot of these synergies sit really, really well with the All Ireland priorities. Also then our colleagues at Queen's, we can't forget our colleagues at Queen's. Professor Joanne Reid's involved in a lot of work, particularly at an international level. She's involved in looking at some work in terms of testicular cancer. She's involved in a lot of work related to cachexia and did a brilliant professorial lecture the other night. There's also some AIIHPC white papers that she's working on and family caregivers, and also then the translation and identification of palliative care in Colombia. I'm not going to steal thunder because I know that Stephanie's here today to present this, but I think we really have to highlight the Compassionate Communities paper and the excellent work that's being done there by Lisa. And also our underserved populations. Again, Kevin's in the room, so Kevin is available for anybody that wants to talk. I'm going to call him a legend in terms of palliative care and dementia across the world. So he will tell you about his work. And I'm delighted to see that Professor Audrey Wilson is going to be presenting her work later on. So we're a small island, but look how much fantastic research we're doing. And look how far we're reaching. And can I also just note that all of the people I've highlighted there are part of the All Ireland and part of the Palliative Care Research Network. We couldn't do it without you, so thank you.